Welcome to the Deep Dive. We're here to unpack complex info and give you the key insights. Today, we're diving into something really serious. The health complications of female genital mutilation, or FGM. We're drawing on a big 2025 systematic review and meta-analysis by Christina Pallitto and her team. Our goal, to really help you understand the profound health impact this practice has throughout a woman's life. So let's get into this. This wasn't like a small look at things. This study pulled together data from 78 different studies. We're talking nearly 500,000 women and girls involved here. What was the main takeaway from looking at that huge amount of research?
Well, what's really striking is just the sheer volume of evidence they synthesized. It absolutely confirms that FGM is linked to a whole spectrum of health problems. But it's important for everyone listening to grasp that this is based on observational data. That means researchers are observing what's already happened, not conducting controlled experiments, you see.
Ah, right. Observational.
And nearly half the studies they included had, well, some methodological limitations. Things like maybe not fully accounting for all confounding factors.
Confounding factors. Like other things that could also be influencing health outcomes.
Exactly. So we're seeing really strong associations, definitely. But figuring out the exact cause and effect pathways can be, a bit complex sometimes.
Okay, that's a really important point. So strong links, but we need to be careful about saying A directly causes B in every single instance. How does that nuance shape what this means for individuals affected?
Well, it means the findings paint an incredibly stark picture, really reinforcing what experts have known for years, but now with just overwhelming statistical weight behind it. Take obstetric complications, for example. Women with any type of FGM were significantly more likely to have prolonged labor and obstetric tears.
And there was something really striking in the data about episiotomies, wasn't there? Especially for certain types.
Yes, absolutely. This really stood out. Women with FGM type 2 or type 3, those are the more severe forms. Type 3 is infibulation. They were over 6 times more likely to need an episiotomy during childbirth.
Wow, 6 times. Why are those specific complications so much more common?
It largely comes down to the anatomical changes. FGM, especially in infibulation, can physically obstruct the birth canal, which, leads to a whole cascade of problems during delivery. And beyond just childbirth, the study found much higher risks for genital tissue damage, particularly for FGM types I and II like, a 9-fold increased likelihood. That's huge.
9 times.
Yeah.
That's staggering.
It is. And interestingly, there was also a finding that women with any FGM actually had a reduced chance of getting sexually transmitted infections, including HIV.
Reduced?
Yeah.
That seems counterintuitive.
It does, and it's something that definitely needs more research. It could perhaps be related to altered anatomy, creating different kinds of barriers, but the exact reasons, well, they aren't fully clear yet.
Okay, so the physical side is obviously extensive, but this deep dive also looked beyond obstetric issues, right? What about things like urinary problems or sexual health?
Absolutely. They found increased risks for urological problems, too. Things like UTIs, urinary tract infections, and just general difficulty urinating. And when you look at sexual health, the findings were pretty stark. Women with FGM had nearly 4 times the likelihood of painful sexual intercourse.
4 times.
And over 3 times the likelihood of experiencing sexual dysfunction more broadly. And then there's the mental health impact, which is severe. Increased rates of depression, anxiety, and PTSD, post-traumatic stress disorder.
Those impacts are so deep and, well, potentially lifelong. When you see this kind of comprehensive evidence confirming harm across physical, sexual, mental health, what's the big picture implication for global health policy?
It's critical, really. These findings provide just undeniable proof of the harm caused by FGM. It powerfully reinforces the need for health systems everywhere to offer high-quality, sensitive care for survivors. And, just as importantly, maybe even more so, the need to invest heavily in prevention programs. This study actually fed into another analysis.
Oh, yeah?
Yeah, showing that just treating the health complications from FGM costs global health systems something like $1.4 billion every single year.
$1.4 billion. It's not just a financial cost. It represents so much suffering, doesn't it? And a huge strain. Did the review say anything about the immediate dangers, like right after the procedure itself happens to girls?
Yes, it did compile data on that too, though often without direct comparison groups, just noting percentages from various studies. It showed around 23% experienced difficulties urinating immediately after, about 20% had excessive bleeding, and 10% dealt with infections.
And were those risks higher for certain types?
Yes, particularly for type 3 FGM, the infibulation type. The immediate risks, like severe bleeding and problems urinating, were reported at even higher percentages in those cases. It just underscores the acute danger involved.
So wrapping this up, what does this all mean for you, our listener? This deep dive into the Pallitto Review really hammers home that FGM causes profound, wide-ranging health problems. Immediate dangers, yes, but also long-term physical, sexual, and mental health consequences. It's a massive call to action, isn't it, for better health systems, better support, and fundamentally for preventing this practice in the first place. What really strikes you when you think about how utterly preventable all these health issues truly are? It's something to reflect on.